Today we'll discuss physiology of hypoxia. Let's define what is hypoxia. As the definition itself indicates, hypo means less, oxia means oxygen. So it is deficiency of oxygen in a tissue or inability of tissue to use oxygen. Now the causes can be, ultimately, as we know, the purpose of transport of oxygen is oxygen from the atmosphere should reach the tissues. So there can be any problem in this. First foremost problem can be simple hypoxemic hypoxia, where there is deficiency of oxygen in the atmospheric air. Due to this, less amount of oxygen is coming inside the lungs from here. Ultimately, obviously, because of this, we'll have a less amount of oxygen in the blood. So that is the first format. It can be because of decreased barometric pressure or whatever reasons, deficiency of oxygen in the atmospheric air, or they can be simply problem in the diffusion sphere. Ultimately, less amount of oxygen is reaching the blood. So hypoxemia means deficiency of oxygen in the blood. So it is hypoxemic hypoxia. That is first category. Now second category, as we know, normally there is a transport of oxygen in the blood through the circulation. So if the circulation itself is slowed down like this, so what will happen? There will be slow delivery of oxygen to the tissue. So requirement it is not met in time. So this is second category called as ischemic hypoxia or stagnant hypoxia because of deficiency of the blood or poor circulation. It slows down. Third category, as a transporter we know for the oxygen is hemoglobin, which is in the RBC. So this transport is going on normally. Here I have shown around 7 seats. So if the 7 seater is now reduced, it becomes 4. So less amount of hemoglobin, less transport. So this is called as anemic hypoxia because of deficiency of hemoglobin or deficiency of RBCs in the blood. We can have less delivery of oxygen from the lungs to the tissues. So in both this condition, they can be good atmospheric air, barometric pressure is good, but in one condition, in ischemia, what is happening? Less amount of blood is flowing because of maybe poor circulation, decreased plus volume, or because of poor pumping of heart, whatever reasons, that is stagnant hypoxia. And in this second category, there is decrease in amount of transporter, maybe hemoglobin, maybe a RBC also. Now third category is everything is perfect, oxygen atmosphere is good, circulation is good, transport is good, but at the tissues there is some problem. So the tissues are unable to utilize oxygen, so it is called as histotoxic hypoxia. This is the fourth category. So now hypoxia is deficiency of oxygen in the tissues. Types, most common 4 types: hypoxemic hypoxia, ischemic hypoxia, anemic hypoxia, and histotoxic hypoxia. Now in each category, it is state of low arterial PO2. Okay, reasons we need to find it out. Maybe in the atmosphere, maybe problem in the lungs, maybe problem in the diffusion also. Ischemic hypoxia, result of inadequate circulation. Again, we have to find so many reasons can be there. Anemic hypoxia, most common hemoglobin deficiency or maybe RBC deficiency also. Histotoxic, because of action of toxic agent at the tissues, the cells cannot make use of oxygen supplied to them, maybe cyanide poisoning or substance which inhibit cytochrome oxidase enzyme. Now, what are the effects of hypoxia? If oxygen is not reaching the tissues, what are the effects? So, most vulnerable organ or vulnerable cell for the hypoxia is our brain. So, there is decreased mental proficiency, which decreases judgment, memory is affected, and performance of discrete motor movement is affected. So, most important organ affected is the brain. That's why we are very. So whenever any person is having any problem with the respiration and heart, First we are doing is the CPR, that is cardiopulmonary resuscitation, because we want oxygen should be supplied immediately, otherwise brain cannot afford oxygen insult. Now when this hypoxia basically starts, when, at what level, especially if there is an external problem. So this effect starts if you are going at high altitude, especially about 12,000 feet. So if you are going on a mountain which is at 7,000, 8,000, till then no problem, but at 12,000 if you are reaching suddenly, you may develop a problem. The sickness begins in few hours up to 2 days. Drowsiness, lassitude, mental and muscle fatigue, sometimes headache and euphoria. If a person stays at 15,000 feet for 1 hour, mental proficiency ordinarily falls to about 50% to the normal. And after 18 hours at this level, it falls to 20% of the normal. Above 18,000 feet, twitching and seizures, that is convulsion, starts. Above 23,000 feet, coma and followed by death, unless until you are having an oxygen support with a oxygen cylinder. So some people who are going fast to the mountain, they develop acute mountain sickness. People who ascend rapidly at high altitude, so there will be acute cerebral edema, acute pulmonary edema. But when they ascend slowly, can withstand for low atmospheric oxygen concentration rather than they ascend rapidly. So it's always advisable when you're going to mountain, you have to go slowly so that you can adapt. That is called as acclimatization. So if you adapt slowly. So treatment for hypoxia is oxygen therapy. Now it will depend basically on what type of hypoxia you are having. If it is due to atmospheric deficiency of oxygen, if you give oxygen, immediately person will get normal. But if problem is with the circulation or anemia, you have to correct it. But immediately we have to give oxygen, but you have to make the arrangement immediately for the blood transfusion or any other thing. But if there is a silent pausing, we have to look for other things also. So atmospheric hypoxia, in hyperventilation hypoxia, we have to give 100% breathing with oxygen. Hypoxia caused by impaired alveolar membrane diffusion, you have to give oxygen. But if you are giving pure oxygen for more time, again it can lead to oxygen toxicity also. So pure oxygen is breath at 2.5 atmosphere or greater. Excess oxygen generates hydrogen peroxide and free radical that destroys the enzyme. They damage the nervous system. So we cannot again afford to have pure oxygen, that will be damages. So here we are completing our important topic, that is hypoxia.